global happenings today. We communicate, we analyze global news. Stay tuned.
Hello, beautiful people. Welcome to Global Happiness Today. So many weeks ago, Nnamdi Kanu's health came into the picture, of which it was trashed out. The lawyer brought it brought it to the notice of the court, which was also trashed out. But as you speak, it looks like there's more information under, and more things are coming out that are not known to the public yet. And right now, lawyers of Nnamdi Kanu have decided not to keep quiet because it's getting out of hand. Before we go into the news report, like and subscribe to our channel by clicking on the red subscribe button. Beside it, you'll see bell notification icon. Please go ahead, click on it to get notified as soon as we update our channel on YouTube. Well, as we speak, Counsel to Nnamdi Kanu, that's Maxwell Okpara, has petitioned the Medical and Dental Council of Nigeria, MDCN, alleging that some medical doctors employed by the Department of State Security Services DSS were unprofessional and reckless when examining their leader, the secessionist who is standing trial for treasonable felony. Maxwell in the petition added that another doctor signed a medical report on Kanu without examination nor diagnosis. He, that's Nnamdi Kanu, confronted the doctor and asked him how he wrote and signed a medical report of a patient that he neither met nor examined, the lawyer stated. He alleged that Kanu, that's Nnamdi Kanu, who is in DSS custody, has been battling medical challenges but was being denied access to his personal doctors. Okpara said on Tuesday he, that's Nnamdi Kanu, complained about the said doctors of their recklessness, incompetence, and unprofessionalism in their practices towards him. Despite his request for his personal physician, they continue to take his specimen without giving him any result. As a result of these ugly, unprofessional medical activities, MNK, meaning Nnamdi Kanu, instructed me to file an enforcement of fundamental right action against the Department of State Services DSS. We filed the said enforcement suit as instructed while the suit is pending in court. The DSS on the 5th of March 2022 assembled some doctors at the DSS and brought MNK out and handed him what they referred to as his medical report. According to MNK, he quickly perused the purported medical report and he discovered that his major potassium illness, which has been his routine drugs over the years, was not even contained in the said medical report. He started questioning the authenticity of the report and immediately discovered that the person who signed the report never met him. He confronted the doctor and asked him how he wrote and signed a medical report of a patient that he neither met nor examined. The said doctor couldn't respond. Now, this is worrisome. How did we get to this level? What does it take really? What does it take really? It doesn't take anything. At least from the last we know of our constitution, he has the right to health care. Even the international community is allowed. Even those on roll call safe, on death sentence, if they're already in prison, they give them such access. They still have their right to, with due respect. Now, see how intelligent. See, sometimes it's good to be intelligent though. They handed him over a medical report. He knows his medical history to a good extent. He looked at the medical report, and there's something he knows, an element he knows he usually suffers, that if you have not tasted them, you will not know. Except he opens his mouth to tell you to, you also will not know. So say, okay, if this is the report, let him see that is medical illness, because medical diagnosis he had that no one knows. It should be there, being that it was a test conducted. Alas, it was not there, which means this was some sort of fabricated report that looks like something. And some of the examination he goes through, tests that they don't even give him. Then they now give him the one that was not conducted. as a sharp man, quote and unquote, that he is, he looked at the medical report. He didn't see the one that he takes potassium over because of the issue of potassium he had. He didn't see the report. And when he requested to know who signed this, because this is serious. If the corruption gets to that level, it's a bad one. No? If you get to the level of medical family, these guys have sworn oath to life, oath to protection of life. Both medical doctors, nurses, those in medical field, they sworn oath to protect lives. So if they can do that, I think Nigeria needs special prayers as well. On finding out the doctor who signed this, of course, the doctor has to come out. You signed it, you're confident that you have done your examination, and this was the result you found. To Nnamdi Kanu's surprise, he has never met that doctor before. So how did you get the specimen? When did you interview him? When did you do diagnosis on him? How did you get this then? And hence, and that's the first time, the suit, the first one was still pending. They struck out the first on some basis. Okay, the one they struck out was that Nnamdi Kanu should not bother coming to testify. That all they need is a documented evidence. Documented evidence now is what was given to Nnamdi Kanu some few hours ago. So okay, he wants medical report. See a medical report. So that in the next hearing, which is going to come in a few days' time, they'll give him this is documented report to show that each time he goes for medical diagnosis, this is the report. This does not need his own personal medical doctor. Lo and behold, he checked the medical report and found out that his regular ailment is not even there. And that's another thing entirely. Now here's Nnamdi Kanu, as a sharp being he is, having noticed that there's an error, is now going to capitalize on it. Now, with that report now, which he's now holding, I'm sure he must have given it to his doctor. He's a lawyer to hold, after it's now his. They can tender that and probably have another doctor, probably his doctor, re-examine him. And if they re-examine and find out that potassium issue, it's going to be a serious case. And this time around, it's going to be evidence. They call that one Exhibit 1 against Exhibit 2. If Maxwell Okpara, the lawyer to Nnamdi Kanu, knows his onions, I think he should keep that particular medical doctor's report, and do an independent one differently. And Nnamdi Kanu should ask, he knows his medical history. They should do something that will reflect on his potassium issue, so they can compare and contrast. This is not going to end well. If he knows the dynamics of his legal team, they should be able to dance through victory in this one. I guess that's where we're going to wrap it up. Nigerians are talking seriously at the background, but won't be able to take all the comments. They are huge. Let's hope that this time around justice will be made. Let's meet in that comment section.